Hello and welcome to a special one-hour edition of State Matters. I'm your host, Matt Muratore. On March 13th, 2020, Governor Baker declared a state of emergency in Massachusetts. And on March 14th, 2020, the very next day, PACTV played host to the first of what turned out to be 100 COVID-19 update shows for the town of Plymouth. Joining us today are the first participants of that show: the host of the COVID-19 update, Plymouth Town Moderator Steve Triffletti, Plymouth 400 Executive Director Michele Pecoraro, and the past chair of the Plymouth Select Board, Ken Tavares. Also joining me as a special co-host for today's one-hour special is Julie Thompson, Executive Director of PACTV. Julie, thanks for joining me today.
Thank you.
On this special one-hour edition. You know, when talking to Donna Rodriguez about the next show, it was Donna's idea, why don't we do something on the 100th episode? Yep. And the idea of bringing you on as well, because you were instrumental in getting this going for all of us. You never said no to anything. Right. And so why don't we tell the viewers, you know, how this all came about with you and Steve to this first show?
Well, it was really Steve who, after meeting with some of the town leaders about town meeting, decided that he had to get this information out. And it was changing so rapidly and so many departments were involved that we needed a place where people could go that wasn't a website, that wasn't 5 different places, but where they could get from the horse's mouth what was going on in different departments. And he just, right from day one, he identified people that should be part of this organization, part of the show. And he ended up having an educational component, a state house component, a health component, a mental health component, a school component, a tourism component, business component, because everybody was concerned and this was affecting them differently. So we just decided whatever they needed to do, we would do it. And we didn't even talk about Zoom in the first episode, which I rewatched a number of times.
Or we never wore masks.
And or talk about masks.
Yeah.
They weren't even mentioned in the first episode. So we have come a long way. And really, it was your brainchild, Steve. So we have to thank you for starting it and for going 100 times.
Steve, what made you decide so quickly? I mean, like I said in the opening, the governor declared the emergency on March 13th, and the very next day, on a Saturday, you had us in the studio. But what made you decide that we needed to do this so quickly?
Matt, well, first of all, thank you for inviting me to join you. And Julie, thank you for all of your support throughout the pandemic. What happened was I called an emergency meeting at Town Hall with officials to talk about the upcoming town meeting because it was weeks away, and town meeting requires a lot of planning with a lot of parties. And it became very clear quickly that we were not going to be able to proceed in person the first Saturday in April. And actually at that meeting, I called Julie because I knew that we needed to get out the information as soon as possible in a variety of formats. And I've always felt that while some people read the Old Colony and some people listen to WATD, that even more people are going to be able to tune into TV, particularly to our seniors who might not be using the internet. So that was really the first call that I made. And Julie graciously agreed to provide us with the opportunity to have forums to speak to the people in the town.
Ken, what were your thoughts at that time? Were you on the same page as Steve as well?
I think we were coming at it from different directions, but I knew that we needed to be unified in going to the town and saying how we were going to conduct the town's business. I think most of us thought at that time it was going to be, just for maybe a couple of months. Not realizing that it was going to extend out 15 plus months after that. But I wanted to make sure that the Board of Selectmen was on the same page as the moderator, the town meeting members, because we needed to be together and not torn apart trying to conduct the town's business. And we knew it was going to be different. And we really didn't have a master plan that we could have opened to the page and said, this is how we begin. But it was certainly the coming together of the town manager, the board of selectmen, the moderator, town meeting members, and of course, the very important role of PACTV to say, we need to communicate.
Yeah.
Matt, if I could just add to
Yeah,
what
go ahead,
Ken
Steve.
said, because he brought up a very good point. We wanted to control the messaging, and we wanted to make sure that it was being delivered accurately, because there were so many rumors going around town. So if it was a school issue, we wanted the superintendent to deliver it. If it was something's going on in town, we wanted the town manager to deliver, or Ken as chair of the select board. So we were very concerned that the people who were directly responsible for making decisions were the ones delivering the message.
Yeah.
And also, Steve, I think it was important for us to deliver that message collectively, because we were getting confusing information, not from the Commonwealth, but from the federal government. And that's when I realized that we need to straighten this out. Otherwise, we're going to have a community in chaos. And thankfully, that didn't happen.
Yeah. And there was no stronger message that needed to get out than what was happening with the Plymouth 400. And that was the other reason you were on the show, Ken, because as the president of the Plymouth 400. And that's why we brought Michele in. And Michele, what was racing through your mind at that point? The big event was coming up in April. But we had to get that message out there to people.
Exactly. I was still in disbelief. We at that point, at the point that this show happened, we figured 2 weeks we'd be quarantined, and then we'll come out of this, and then we'll just move our events. And since then, we have moved and changed our events and our virtual events now to Plan F. So we went Plan A, Plan B, and we went to C, then D. Then E.
Be careful, this is a family show.
So,
be careful. I don't want to hear about that Plan F.
It was, yeah, I know, right? It was just, it was surreal, really. I mean, really, the Monday after we did this show, we closed our office, and we didn't come back for a year.
Well, also, Michele, remember we had invitations that were going out. My last clear picture of the 400th office was watching people putting stamps and addressing envelopes to begin the invitation, save the date for what was going to take place. And unfortunately, it didn't. But the entire group, the 400 group, was able to regroup and do some amazing work last year.
Thank you. It was a very hectic time. We actually sent those invitations and then had to cancel the event. That was very sad because it took us 2 years to plan that event. We had people from all over the world coming. We had Shishigahama coming. We had our friends in the UK and the Netherlands. We had our Wampanoag advisors ready and just waiting to do this first event. And it was so well planned. I think it would have been a first in Plymouth to have something like this that was that big and that international. And
Michele,
unfortunately, we were unable to do that.
And Michele, people
just
have...
to share a story with you.
Go ahead, Ken.
Just to share a quick story. I had an invitation in my hand. It was a special invitation to a well-known couple in the community, and they were being invited as guests of the 400th committee, to be there for the opening event. And I remember, calling them back saying, I know you have the invitation, but it's not going to happen. That was a sad day. And I think from that point on, we realized, we need to pull together and get this show on the road.
Mm-hmm.
Absolutely.
Michele, you did some great planning, you and your organization. How come you didn't plan for this?
Yeah, we did. And I think I said it in the first show.
Was it the Spanish flu 100 years earlier?
We planned for every... I know, right? We should have looked back and said, this could repeat itself.
Right.
We planned for, Chief Botieri and Chief Bradley and all of the public safety people that we had involved. We had over 60 people on a committee from the FBI and CIA, We had all that. We covered domestic terrorism, international terrorism, unexpected terrorism. We covered, heat stroke. We were worried about people getting heat stroke or being too cold. We covered everything we could possibly. This wasn't something that was in the playbook.
Nope. And you know what?
But we did a pretty good pivot.
You did.
You did.
You know,
And the
our
whole town did.
pivoting started really, really right away because we all said, we're not letting this down. We're not letting this go. We're going to do whatever we can do. And we started hearing about doing virtual events and Zoom. Zoom became a part of our vernacular. Now we don't say I'm going to a meeting. We say I have a Zoom at that time, So, but all of that technology came to us in a way that, we could not have done any of it without PACTV. They came to our rescue many times. So, we have, as a result, many, many good quality video productions of the information that took 8 years to pull together, or more, in some cases more. And we have made hours and hours of video production about that. So, more people will get to see it. More people have seen it. We've done some amazing things. We had books, the Mass Chronicles, distributed to every school in Massachusetts during the pandemic. And we also had a virtual conference at Bridgewater State University, or hosted by Bridgewater State, completely virtual, 9 sessions. If it weren't for Bridgewater State University, we wouldn't have been able to get that done. So people really rallied and came to our rescue, and also to other organizations who needed it at the time.
What a way to preserve history.
Yeah. And Michele, you said something on the first episode, and it comes back to tourism and how the town had planned for so many, like you said, Ken, 8 to 10 years, this has been in the plans in the making. And you said, Michele, so many businesses rely on people who walk through their front door. Can you please continue to do that? So even back in March. And then, Steve, you talked about a store down in Manomet who was the first one to say, you want to buy something, we'll come out and deliver to you. So that was curbside delivery. I mean, way back then, people were thinking of each other. They were thinking about how can we keep this going day after day, keep people in business, keep people working, and keep the light on.
Yeah.
What are some of your first memories of this? When not maybe from the first show, but as the show started going, what was something that really sticks out in your mind? I'll start with Steve.
Well, personally, one of the things was that I was at home a lot, and so, or alone in my office, and so this was for me the one time that I would get out each day was to drive to the PACTV studio, and so it was my way of maybe not being so isolated. But beyond that, I think being on the presentation, it was really a great opportunity to connect. I think, as Ken has said before, and you too, Matt, is that all of us were able to stay in communication with one another even more easily. People would see the presentation. What they wouldn't necessarily see would be the calls or the conversation before and after the show. And I think that's something that I remember. I also wanted to just pick up on something that Michele said about some of the things that happened that wouldn't otherwise have happened. And just in my world as the moderator for town meeting, we experienced the highest level of participation ever in town meeting. Matter of fact, at our last town meeting, we had 134 out of 135 town meeting members in attendance. Only one was not there because of illness, and we had the highest recorded votes of town meeting members at town meeting. So that was a great positive outcome of many of the challenges that we were facing with the pandemic.
Yeah, Ken, same question to you. What was a memory that sticks out to you?
I think the biggest thing that sticks out to me was that we had to find a way to communicate with one another and certainly make sure that the town wasn't falling apart. I mean, there was a lot going on at that time in the world and in the country. And I think at times we felt the drift. And I realized, as members of the Board of Selectmen did, that we needed to pull together if we were going to get through this. And I have said time and time again, and we'll continue to do so, that without the communication, the local communication of PACTV, we would have been in trouble. There was no way that we could have done this via radio, via telephone calls. Having the live meetings, broadcast were extremely important. Without that, I think our community would look tragically different today.
Yeah. Michele?
I think the thing that stands out to me is, as an employer, it was a very difficult time because we did have to lay people off. It was very hard to do that. And the people who remained, there was so much uncertainty. We didn't know what we were going to be able to do or when we were going to be able to do it or even if. So I think as an employer, I was much concerned about the people who worked for us and also people in the town, which is why in that first episode, I said, go in if you can. We didn't know at the time that we weren't going to be able to, but, please, frequent your local businesses because that's where the need is the greatest. And I would say the same for us. We had a lot of good support from a lot of people, both in town and outside of here, who knew that this was a big blow for this organization, especially. You can see behind me, 1620, 2020. It's like,
you should
that
was
our
cross
life.
out that 0 and put a 1 there.
I know, right? I shouldn't have done that for this show.
My first memory of this being real is going to the grocery store and seeing the line. Seeing the line of the grocery, that made it real. And that, it also made it scary as well. For me as a father of, 6 kids and, but a community leader as well, it's like, wow.
Yeah.
So I think for me, having this show, as Steve said, it gave us a purpose. It gave us a purpose of what to do and how we can continue to help others, because as leaders in the community, that's what we do. We're here to help the community. And I really couldn't get to that point of how we actually can do that until this show was able to happen and catch on. And real quickly, here's the book I used to talk about, the College Rule book, that is completely filled with notes. It used to take me 2 to 3 hours initially for every show to prepare for. And then I had to start another notebook here for every single show. But it was so good to be part of this because of that. It helped me personally. What about you, Julie?
Well, I think the most important thing that we right away knew is this is our mission. This is why we're here. We are your local community media center. And we have to do anything we can to support our towns, in every aspect of our towns and our region in general. And we felt honored. We felt lucky that we could come to work every day and we didn't close for 1 second. Not once. We followed all the guidelines, and for a whole year, we had no illness at all in this building. And we just felt, wow, this shows how important local, accurate information actually is. And I think it's proven itself over and over again that the towns that didn't have this had a much harder time than Plymouth did.
Yeah, and we had a lot of people. I know we've all talked about this before, that initially there was thousands of people, I think, watching the show. Wherever we were, if we were at the grocery store or whatever, a text we were getting, we knew people were watching. And I think it was because everything on the national news, people were at home and they were watching. But they really weren't getting the accurate information or local information. And it was also when on social media was blowing up and not giving actual information. I think it was scaring people more, and I
Yep.
think, you know, we kind of brought it real for people. I think that's why people actually tuned in
Yes.
to see what's happening in my own hometown. I can't deal with what's out there now.
And especially, no better example of that than the schools, because every town had different situations with what happened with their schools. And I remember Gary Maestas saying in this first episode that he was really questioned, like, why are you closing the schools for 2 weeks? Because none of the other towns are closing schools, and they might have an outbreak or 1 or 2 kids tested positive. And every day he would come on and give the latest information and why they were doing what they were doing, and he would address all the questions that the parents had. And that's local. That's about us. That has nothing to do with either regional or national.
Right.
It's
And,
local.
and by the way, Gary texted me last night. He was going to join us because he was on the first show, but he's out west somewhere riding motorcycles, and he got delayed by a day. But Gary was a big part of this show as well, and ongoing shows as well. Steve, you were on recently interviewed by.
Matt,
yeah, go ahead. Go ahead, Steve.
Well, I just want to pick up on what Julie was saying and something earlier that Ken said, which is that we were getting mixed messages, not so much at the state level, but at the national level. And so one of the things that we decided early on is that we were going to follow the science and that we were going to be guided by what we believe to be the message from the medical world and the scientific world. And that's why we made that in the early stages. One of the first parts of our presentation was so that people would understand that the schools might be making a decision based on what was being recommended by doctors or medical personnel, and we working with the Board of Health and with our local health officials. So I think that was important. And yes, we did receive a lot of feedback from a lot of people early on, not only the questions that were coming in to the studio to be answered on air, but all of us were hearing it from people in the community, whether they emailed us, called us, or would bump into us at a store.
Yeah. Steve, you were recently.
And I think one population that we got to was the elderly population in the community. We talk about the schools, we talk about grocery shopping, but we needed to communicate with the elders of the community that were in a precarious position of not getting information or not being correct. So I think with the Center for Active Living and what we were able to do with the program, so many older people in the community have said to me, I tuned in every week, you know, because I knew I was going to get the right information.
Yeah. Yep. Recently, I talked to Michele Pecoraro, the Director of Elder Affairs here in Plymouth. You know, I said to her, how did you come up with the idea to actually start contacting seniors? And she said she was home in her basement, and she was getting texts, and she was getting emails and calls from them, and they were just scared. They were worried. And that's how she actually came up with that. And I think it was like 10,000 seniors on a daily basis were getting phone calls and getting accurate information. That's what was important. Steve, I want to go back to you for a minute. You, and this may sound self-serving, but it's not. But it was an important point. You were recently interviewed by WATD, and they asked you, what was the one thing that stuck out in your mind that happened? You know what I'm talking about.
I know what answer you're looking for, and I could go and pivot to something else, but I think certainly one of the most poignant moments, Matt, actually involved you. And I think for those who were watching and those of us who were participating, it was real in the sense that you revealed on air that you had tested positive for the coronavirus. And you talked about how that affected not really even just you, but your family, your children, your wife. And you got emotional. And I thought that was really special for all the viewers to see, because we were trying to make the point that this is affecting us and hitting close to home. And you showed that right on camera. So I thought that was important. But the other one that I mentioned, which I really enjoyed, was that we brought clergy on also to comfort people. And they were from all denominations. And what really stuck out was that even in the darkest times of the pandemic, when many people were feeling a little depressed and unhappy, we brought on Father John Cullity from St. Mary's Parish. And each time he came on, he would grace us with some levity and some very appropriate jokes that really put a smile on our faces. And so those were a couple of moments that I would always remember.
Yes, he was wonderful to have on to listen to his jokes. It just made you a little bit more calmer when he actually came on. And just the reason I brought up the point about my getting COVID, I wasn't sick at all, and I was surprised I had it. But you know, I debated whether to do that or not. But because the show was so real and the show was about us in the community, I thought, you know what, maybe I should bring it out. And I am glad I did.
Yeah, I am too.
Yeah.
And it brings kind of segues into how the show changed over the course of the 15 months. After the first month, I would say, which was really we were all kind of in panic mode of what do we do, what's safe, what should we open, what should we close, what is the protocols. We started realizing that there was mental health issues that were obviously going to be affecting our kids, us. People lost their jobs. People didn't know what to do. People were afraid of they couldn't go visit their sick, elderly, whoever was in the hospital. They couldn't see them. They couldn't see people in nursing homes. The whole mental health aspect of this, Steve, you then started bringing on like Sarah Cloud from BID, who would be so helpful in bringing up those subjects that, hey, this is just another thing that is happening to us as a community. We need to deal with it. We need to talk about it. And I think a lot of people ended up being able to reach out and get support because it was just another subject we brought up because it was happening to us locally.
And she was such a calming influence. I loved when she was on the show.
Me
But
too.
again, I bring it back personally to me. I mean, you kind of needed that. And she was reassuring about where we were at and reassuring what our feelings are. And it's okay. And we're going to work together to get through this.
Absolutely. And the schools really dealt with that on a daily basis too. The teachers, the parents, the learning to be, you're a teacher? No, you're a parent? No, now you're both. That caused a huge upset obviously in people's lives, but also how do you psychologically deal with that?
Right. Yeah.
And we
Matt,
many episodes.
Yeah. Go ahead,
we weren't afraid to deal with these issues. So not only Sarah, we had Dr. Russell Fry, we had the Recovery Center, we brought in a funeral director to talk about how to deal with those things. They were very difficult subjects. They were sad. Some people find them dark, but they were important because those were the questions we were being asked. You know, will there be a wake? Will there be a funeral? Someone's taking more drugs or more alcohol. How do we deal with that? These were very
we lost your video.
These were very difficult. Yes, these were very difficult issues, and we were dealing with them.
Yeah. And even Tim Cruz came on, our DA. Go ahead, Ken.
No. Well, one of the things that really struck me was as we knew we were in for the long haul. We had to go through dealing with holidays. You know, what's 4th of July going to be like this year? Well, it was a lot different than anything we had experienced. What's going to happen on Halloween? Are the children going to be allowed to go trick-or-treating? We're in Plymouth. We had a lot of things planned for Thanksgiving. Nothing. Christmas is coming, Hanukkah. You know, how are we going to observe that? And I think what we did is as a community, we took these big problems that were being discussed around tables and put it out in the open. So we began to realize that we weren't alone, and so many of us were thinking along the same lines. And I think there was a lot of comfort in that, knowing that you weren't alone. And you could kind of lean on other people, even if it was, you know, through a TV program.
And businesses.
We also had to be creative.
Exactly.
You know, we had to be creative about how we got in touch with people. So again, on the holidays, even if you were alone or just with a family member, as I was, you know, we were calling people all over the country, which we never would have probably done on a regular Thanksgiving day. But we were calling everybody we knew saying Happy Thanksgiving. So I think it forced us to look at life differently and find different ways to connect with each other. And I'm hoping that doesn't go away.
And the camaraderie that businesses had with each other, especially the restaurants, absolutely was just heartwarming because they would help each other. One would run out of something, another one would support them. The in the ingenuity that came out of this too was amazing.
Yeah.
People find a way to make it work. And we were able to talk
Yeah.
about a lot of those situations, which again brings it back to what a wonderful community we really have here in Plymouth.
And I do want to bring up too, even as businesses adapted, so did government as well. And you really never saw, and I think Ken can probably agree to this, you never saw government really move so fast. A lot of times government moves relatively slow. But there are a lot of changes that we made on the state level to help businesses, business community, and municipalities. And there are a lot of things that the local level, your level, Ken, that as chair, that were able to pivot and really help out the community as well. Can you talk about that a little bit, Ken?
Sure. I think what comes to mind is that there was the opportunity to grant various licenses for outdoor dining, for the sale of alcoholic beverages. And I remember more than once being in communication with the fourth floor of Town Hall and someone saying, can we have a special meeting so that these folks can take advantage of the weekend and what's coming up? And the board met as the licenses were needed, and no one complained about it. I mean, we had to adapt our rules, which are fairly strict, with the various licenses, but we did it. We made exceptions and tried to help out one another. So I applaud the people that were in the background. And, some of us, have high visibility during something like this, but we can't thank enough the people that are in the background making these things go on. And they did this day after day, to save the community. And I will always be indebted to whether it was safety officials, health officials, or people working in stores. They put themselves right on the line and did it without questioning. It was certainly a time that we realized we had to help one another if we were going to come out of this hole.
Yeah, I was just going to ask that question.
Matt, if I could just...
Yeah, go ahead, Steve.
We also were faced with challenges and criticism from the people to whom we were serving. And again, in my world, in town meeting, Matt, you were very instrumental in coming up with legislation at the state level that allowed us the possibility to meet with the business of the town remotely for our legislature. And once that legislation passed, there was not unanimous support. In fact, people were looking at what other communities were doing and saying, if they're outdoors or if they're meeting, why can't we meet? And we did have resistance from a significant minority of people, and yet those of us in the position of making decisions went ahead with what we thought was the best decision given the science and the information we were getting. We got the cooperation of PACTV and the Select Board, and we moved forward. And interestingly enough, once we had our first remote town meeting, many of them came back to me and said, I was opposed, I voted against it, but it was the right thing to do to have it done remotely, and I'm glad that we did. So again, as officials, we were faced with making decisions that weren't always supported, but we had to do, and many times, make the tough decisions. And yesterday, following our 100th episode, I did speak with the superintendent of schools, and he said the same thing, is that, they often, with every decision that they made, there would be people who wouldn't be in agreement, but you had to move forward.
And with that said, nobody was criticized more than Governor Baker. And, I was one of the people that kept defending him. And it goes back to what you said earlier, Steve. We were looking at the data and not the dates. And as a healthcare professional, I agree with that. You have to look at the data, not the dates. And we were making decisions here in Massachusetts to save lives first. We had over 60% of the deaths in the Commonwealth came from long-term care facilities. So that was the first group of people who were getting vaccinated. But they can't go out. So we made a conscious decision. We were going to go to them. But think of the logistics of that. 50,000 people in long-term care facilities and needing 2 shots. So we brought CBS in. They had to come, get the shots to every single facility. There's 350 facilities. And then they had to come back again in 21 days.
Yep.
That took time, but he was criticized because other states were getting vaccinations out quickly. But it was well thought out how we did it here. But again, it goes back to what you said, Steve. We were doing what we thought was the correct thing to do and not what the politically correct thing to do is.
And you're never going to please
No.
everybody, ever. Another big component of all of this was financial. The financial hit that businesses took, that individuals took, that the town has taken, that the state has taken. And the information that we brought forward that you would constantly update us on PPP. Steve, you would have an accountant on all the time, and she would talk about individually what this means to your business. And people had questions about, do I have to pay my taxes? And then do I get a delay or an extension in what I have to do? So that whole financial end was another offshoot of this, that it's personally, everybody was affected, but also the town was, and the state was.
Yeah. Ken, you talked a little bit about some of the real heroes in this whole thing. There were a lot of essential employees needed, but if you take yourself out of what your current roles are and what your roles at the time, and just a member of society, what group of people stand out as heroes in your mind? Michele, we'll start with you.
Well, I mean, we all will say first responders. I know that.
Right.
But personally, I think the people that helped the most, or the heroes, were those people who would literally pick up the phone and do a wellness check, just with a friend or a relative. I think they are the unsung heroes, because honestly, people needed. We talked about mental health. People needed that connection. And, I had a few people who called me, and I didn't feel like I needed it, but who called me to say, we're really sorry about everything that's happened. And we know this is something that you've been working on for a long time, Plymouth 400. My greater concern was that people were unhealthy and that we needed to get past this. But I think it's those people who didn't hesitate to reach out, as you've all mentioned, and did something, whatever that thing was, whether it was virtual or in person with a mask at a door delivering food.
Yeah. Steve, same question to you. Heroes?
Well, Matt, you may recall, just before the shutdown, early in March, I was not only diagnosed with cancer, but I was hospitalized for a day procedure that had complications, and I spent a week in the hospital. So certainly all of those people were heroes to me. They're helping not only me, but everybody else at a time when there was no room at the inn. I was actually, for that week, for the first couple of days, I wasn't even in a regular room. I was in just a holding area with curtains. And there was a great risk. People, didn't quite know what was happening. And even as the pandemic went on, later in the year, I had to have immunotherapy. And again, the health personnel, they didn't blink when it was necessary to provide treatment, even at risk. But the other heroes that I would say would be everyday people who were willing to make sacrifices and follow the recommendations made by the science community. So whether it was please wear a mask, and those people that immediately followed on board, or please do the distancing, please, the kinds of things that we were asked to do, for the most part, locally in our community and even statewide, people were doing it. And I noticed it if I were looking outside of Plymouth or outside of the state of Massachusetts. And even today, when we see the vaccine rates, we see that of those states that have over 70%, Massachusetts, the New England states, and I think New Jersey and Hawaii. And so I'm proud of the fact that everyday people are heroes insofar as they are pulling together to try to beat this pandemic.
Yeah.
Yep.
Julie?
Heroes. Well, obviously, the people that stocked the shelves in our grocery stores.
Yeah, I was going to say that.
Every time I'd go into my local grocery store, I would intentionally go up to one of them and literally just say, I know you must have your own struggles. Thank you. thank you for coming to work every day and doing what you do. And they got abused by people like, why don't you have toilet paper? And why don't you have this? And remember, there was no meat, there was no chicken, there was
Right,
like,
yeah.
there was no vegetables. It was
Yeah.
just bizarre.
Yeah.
It didn't last long, but they were probably barraged every day with that. And the other ones are the people that kept a sense of humor. We saw the funniest memes and things would show up, like the funniest masks and right. I mean, there were things on Facebook that we would share, and I had my office walls pasted with all these cartoons and all these memes because we needed to laugh.
Yeah.
We need a sense of hope and a sense of humor during this awful time. And for all of those who came up with these creative ideas just to make somebody smile or laugh, you were my hero.
Yeah, yeah. So,
What about you?
True, so true. Yeah, I would. Everything you all said, all those groups of people. You know, we have to add teachers to that as well. Teachers are always heroes, but for what they had to pivot and do during this time. And again, it was mentioned too, particularly in Plymouth, that we did what we thought was best in Plymouth, not what other towns were doing. And I think that was the leadership of Gary Maestas and then Chris Campbell, who took over. And but you know, the folks in the Board of Health as well. You know, Board of Health in a community have never really, they've been there, but they have never been so important than they were during this. And I hope that's one of the things we take away as communities, that we always keep the Board of Health, you know, up there with, you know, the Select Board, Planning Board, you know, Zoning Board, some of these other boards. And Ken, I know you worked closely with Dr. Barry Potvin and his board and Karen Keene. Can you talk a little bit about how important they were?
Yeah, I think the entire community and especially the leadership in the community realized what the real role of the Board of Health was. I kidded with members of the Board of Health. I said, you know, you used to do septic system permits. You know, you'd hear about that at your meetings, or somebody had a loose rooster in the neighborhood and you needed to come up with something to, you know, to take care of it. But I watched the Board of Health just rise to an entirely new level because of its leadership and its members that are serving on the board. We're in a new world now. The Board of Health isn't going to be taking a back seat anymore. I think they're front and center. We can see, you know, what they can do and how they can be helpful to the community. I give them a great deal of praise. Karen, the health director, has done an outstanding job with her staff, you know, and implementing the decisions of the Board of Health. We were very fortunate to have the caliber of people that were in place, and that made a big difference. Even recently, the decisions that the Board of Health has had to make are tough. They don't put you on the popularity poll very high, but they have not been afraid to do it. And I remember talking to the Board of Health members saying, you know, I know your job is tough, that there are things that we have to do that we're not pleased with, but I'll stand beside anyone that wants to yell at me and say, you shouldn't have done this, that, or the other thing, rather than be standing with them at a funeral somewhere and saying we should have or could have done something better. So you're right, Matt. Thank you to the Board of Health for really coming of age in the town of Plymouth.
Yeah, and I'd be remiss if I didn't add this too. There was two parts to the show on March 14, 2020.
Yep.
And it was, at that time, it was the chair, Brigitte Keene, and Karen Keene that were actually on the show as well.
They did the whole health segment. And it was so funny. And I watched it again this morning. And that's what struck me is they talked about social distancing. They talked about flattening the curve. They didn't talk about masks.
Yeah.
We weren't there yet, which was so bizarre.
Yeah.
And just two other people, I think, groups to thank is delivery, the mail, and delivery services. I mean, a lot of us, where would have we been without delivery services? So all of those people. And the groups that started these, like the One Fund in Plymouth, which was the chamber, and I think Mask for Meds got together to do the One Fund. Every town had that type of fund set up to help and support people who didn't have enough.
Yeah.
And bless all of them.
I'm going to put a plug in too for childcare too, because
Yes.
I own some childcare centers.
Yes.
Yep.
But people forgot the fact that there were several childcare centers in the Commonwealth that they all closed. But the Commonwealth was offering folks they'll pay them if they stayed open, because these essential workers still needed to work.
Right.
So there are a
Yes.
number of centers that that actually stayed open.
Yep.
You know, March, April, May, during the height of all this, risking their lives as well to keep the economy going as best as possible.
Yep. Absolutely.
yeah.
You're absolutely right.
Yeah. What were some of the words that will now stick with us? Do you all think in this new society? I know we talked about Zoom.
Zoom.
Yeah. None of us heard of Zoom before that. Is that correct? Yeah.
Yeah, and Zoom, and the funny things about how people, you'd be looking up their nose, you just see this part of their face. Zoom etiquette, it was hysterical.
And I would do that.
etiquette.
once in a while,
Oh, you
too.
would.
Can
you
you
would.
see
yeah.
me?
Yeah.
Hello, knock on that.
Yeah.
Yeah. So Zoom.
Yeah.
What are some other words?
Flattening the curve. You
Flattening
just
the
said
curve.
flattening the curve. Never heard
Yeah,
flattening the
flattening
curve
the curve.
anymore. Yeah, yeah.
Social distancing. I mean, we
Yeah.
never talked about
Right.
that before.
Yeah.
Right.
No.
I wonder, do you think that we will, as a society, continue wearing masks when we are sick? I know we've gone to Shishikahama before, and in the Asian world, if you're sick, you wear a mask so you don't get anybody else sick. What do you all think? Do you think we'll still continue wearing masks as a society? We're going to start with you.
I know-
I think people will. I think that some people will. I know that wearing a mask has had other benefits for me specifically because I have pollen allergies. Well, guess what? You can wear a mask and you don't find that you have those allergies so much. I mean, look at what happened to the flu. I mean, of course, people weren't out, but we also wore masks. There was a very low incidence of flu this year.
Yep.
Yeah.
So I think it could really help people in the future
Yeah. Hey, Ken.
without drugs.
Yeah,
Yeah.
right. What do you think, Ken?
I think we're going to forget.
Yeah.
And if we're not reminded, we're going to slip right back. And I mean, because you're already seeing that happen now, the pace has been accelerated. People are saying, I've been inoculated twice. I have the 2 shots. I think we might ease up on it, and we're going to have to stay tuned. Again, a good role for the medical community, for the Board of Health. How do we protect ourselves going forward?
Yeah. Steve?
My wife and I have talked about traveling, and we've agreed that when we travel, we will wear a mask on planes and when we're in situations of large crowds. And in part, that's not only for us, but I think the responsibility that we feel towards our families, and not just family of origin, but in my case, I have a newborn granddaughter and a 1-year-old grandson, and I have my work family and the people in the office. And so I certainly do not want to bring any kind of disease or problem unnecessarily to the people that I love and care about. So I think we will still try on a personal level to use a mask when appropriate.
Just one thing before Julie, you ask. Do you all remember your first mask and how you got it? Because you remember we couldn't use the surgical mask because people because the hospitals didn't have enough, the healthcare centers didn't have enough.
Right.
Do you remember how you got your first mask? I do. Steve Minsky's wife, Steve, you know Steve Minsky very well, and his wife Hazel was making masks.
Yeah, a lot of people
And
were
I
doing
bought a
that.
whole bunch of them from her for all my family.
Yep,
Yeah.
a lot of people were doing that.
People were so creative.
Yep, and they were, I know in Pembroke, people would put masks out on a clothesline, and people could just come pick the masks up for free. There was a lot of that.
Wow.
Do you remember getting your first mask, Steve? Was it Hazel Minsky?
Yes,
that helped?
same.
Yeah.
It
Yeah.
was Hazel,
Yeah.
and it was the Sunrise Rotary Club fundraiser, and I think we
Yeah.
were competing to see who would raise the most money and get the most masks.
Right.
But and then after that, my office worked very hard to try to order masks for
Yeah.
everybody. So that
Yeah.
was
Yep.
helpful.
Yeah. Do you remember that initially, Ken, trying to get the first mask? How you got it?
I do. My wife Maggie made the first mask,
Yeah,
and then all of a sudden, other members of the family and reaching out were asking for them. But I remember my second mask also.
Really?
That I remember that I had masks from sanding down in the basement. Not
Right.
being a big work guy, I did remember that I had some hidden somewhere down in the basement and brought them out.
I had the same experience. I went crazy. I knew there were N9 masks in a plastic container somewhere in the house, and I went nuts looking for them, and I did find them, and they were dusty, and the packaging was dusty and gross, but the masks inside were still good. So
Yeah.
that was my
I was afraid to use it because somebody would say, you're not a medical person.
Right.
Right.
So I didn't wear it.
Yep, right.
Right.
My
Right.
first designer
the
mask,
container.
though, was the Plymouth 400.
Yeah.
I'd somehow seen Michele somewhere, and she had these masks made,
Yeah.
and so
Yeah.
this is terrific.
Yeah,
Yeah,
good
I have a logo
advertising.
on it. Yeah.
Sure, advertising. Yeah.
Yeah.
Before
Yeah.
we talk about silver linings and the good
Yeah,
things,
yeah.
which I wanted to do, thoughts about we're not certainly out of the woods by any stretch of the imagination, and there's a lot of questions about opening back up and requiring vaccination proof and wearing masks or not wearing masks and having customers wear masks or not wear masks. That is going to be changing, correct? The guidance on that will probably change. I know that the governor waited 2 weeks after the president announced that we don't have to wear masks anymore if you're fully vaccinated. But do you foresee that we're going to have some legislation or some guidance? Because a lot of businesses don't know exactly what can and can't I do.
Yeah, no, I think the president and the governor of this state have been pretty clear that it's very difficult to mandate wearing of masks.
Right.
So it's really going to be up to the individual organizations and individual businesses to decide, how you want to wear a mask, and trying to get people to show vaccination cards. That's going to be a difficult thing to do. Although I think, as Steve mentioned before, I think airports. Airlines may be someplace that you're going to have to do it.
Right.
Maybe large stadiums like Fenway
Yep.
Park, TD Garden, places
Yep.
like that. You may have to do it.
I know cruise ships are now requiring
ships,
it. You
yeah,
can't even get
exactly,
on
yeah,
one.
yeah,
Yep.
yeah,
Yep.
yeah.
So that might change though. That
Yeah.
might be a kind of
Yeah.
an update that we'll have to do down the
That's
road.
going to be an ongoing conversation. I
Right.
think about that. Yeah.
Yep.
Yeah. You just hope people do the right thing.
Exactly.
Yeah.
And common sense prevails, please. And what about silver linings? I
Yeah.
always like to look at the silver linings that have come out of anything, as bad as this was in a lot of ways. Who has a silver lining that they want to talk about? Let's start with Steve.
I can certainly, yes. When we've talked about Zoom, but I want to say how it's affected the quality of my workplace. I haven't been in a courthouse since last March. And in fact, after this taping, in less than about 25 minutes, I have a hearing scheduled in the Hingham District Court. I happen to be in another state right now. That never could have happened previously. And also, from a financial point of view, it's good for my clients because they're not paying for me to sit in a courtroom when court begins in session at 9 a.m. if I'm not going to be called until 11 or 12 in the afternoon. So that would definitely be a silver lining for me and for the people that I serve.
Excellent. Ken, what is your silver lining that you've taken away from this pandemic?
I think it has, for me, emphasized what a caring community I live in. And I am thankful for that. I've seen so many good things happen, and I'm sure we're not going to forget them. Plymouth, rightfully so, on its 400th commemoration, has taken a leading role in fighting this virus. And I'm happy for that. And I think it shows that we have what it takes, and that's 400 years later. Yay for us.
Yep. Michele?
Oh, there are so many. I always try to look at things optimistically, even in the face of a global pandemic. Well, for Plymouth 400, I think the silver lining has been the fact that we now have a full record of on tape of well, or digitally at least, of many of the things that actually would not have been as prominent during events. For example, we have a show on PACTV called Plymouth 400 Conversations, where we've actually talked to people who did work, academic work and other work, writing books, film, other types of projects that never would have seen the light of day, with the exception of, you know, being in a bookstore or perhaps on Amazon. But a lot of people don't publish to be on Amazon. And so we've been able to capture what they did, what their projects were. That for us was really important. I think in general, I think people are more forgiving. You know, we know now that we don't always have to have the meetings where you drive to Boston for half the day and then you drive to the Cape for the other half of the day. We can do it all from one place. And that, I think, is going to change the workplace going forward, because it saves companies money. It's better for the employees. And I think people have found finally that working from home is as productive, or maybe even more productive, than working in an office.
Yeah.
Yeah, I agree with that, Michelle. And I, for one, am very happy the last year I've been able to do that. You know, since I was, 16, had my first job and went to school, and then went to college, I had a job. And I've always done two things, either, 2 jobs, sometimes 3 jobs, for my entire life.
Yeah.
And this is the first time I was able to, be at home. And my kids got so used to it until the beginning of this May. I've always been home doing Zoom and very rarely would go out.
Yeah.
And now my kids are saying, and we're close to Memorial Day with this taping right now, and my kids are saying, when are you coming back home?
Right.
Mom can only do so much for us.
Right, right.
All these kids and driving them here and there and all that. But you know what? It made me feel good to hear him say that. But I also really enjoyed being home. And I agree with all of you. I think we were more efficient, as Steve said, with the courts too. And we're more efficient in our role as a state rep as well. And the business I'm involved in as well. We're more efficient in what we're doing. But having that quality time at home has made the world of difference to me.
And I think this whole thing has made us appreciate what freedom really is. Freedom is being able to get in your car and go to a movie. Freedom is being able to do the things that we always took for granted. And I hope that we learn not to take it for granted anymore. And the other thing is, by staying home, I know neighbors now I never knew. People that you just pass in the night.
True.
And all of a sudden, you live here? This is what my neighbor looks like? It's crazy. But it's again, it comes back to that community connection, which we can't lose.
Yeah. Well, Steve, I'm gonna take a page out. Yeah, go ahead. Go ahead, Ken.
I think that one of the things that I've observed is how the young people, and I'm talking about those in grade school, that aren't 18 or 21 years of age, how they have accepted what's gone on, how they've dealt with it. And it has given me a great deal of peace of mind saying, you know what, this next generation coming along is going to be okay.
Yeah,
they've gone through something that's been difficult, but they've done it with flying colors. Listening to the discussions with my own grandchildren, it makes me feel so much better. They've been paying attention. They will do better. They will do better.
Yeah, absolutely.
Yep.
Steve, I'm going to take a page out of your playbook. At the end of every show, you go around and ask people what are the final thoughts. We're wrapping the show up right now. Quick final thoughts from all of you. Steve?
I would just say one thing that the pandemic has really reinforced is the importance for patience, for tolerance, for understanding for people, and also for optimism, that even though we were faced with a very difficult, dark time, now we can see a light at the end, and certainly the vaccinations have been a great thing. And so I feel blessed and happy that we've gotten through it and that we're moving forward.
Yeah. Ken? Last thoughts?
Well, I'm looking at it from the perspective that my grandmother had a saying that life is for the living. And I have certainly, seen that in the last 15 months. I think that we have brought ourselves together as a community, and the future is bright for us. We can't let our guard down. We've got still a lot of work to do, but I'm very optimistic about it. And I can tell you, I feel a lot better today than I did a year ago.
Yep.
Yeah. Michele? Michele,
we're
real
on
quick.
the rise.
Real quick, Michele?
Yeah, I mean, well, things are opening up. We're able to finally do a couple of live events, and we're very excited about that. So stay tuned. Go to our website for June, July, and September.
Okay.
We're really moving forward.
Great,
Excellent.
great.
And I just appreciate all of you so much, and I adore you, each and every one of you. Thank you.
And I just want to say in closing that we thank you, PACTV, the entire crew here for what they always have done,
Yep.
but what they really have done during this pandemic. And I think it's all of us that are watching today and all of us in the panel, whatever you believe in and the ultimate being, somebody was telling us as a society to slow it down, enjoy what's in front of you.
Yeah.
And let's continue to do that.
Agreed.
So I want to thank all of you for joining me today. Again, Julie, thank you so much for
Yep.
co-hosting with me. The entire crew that's here at PACTV for what you do for this show, but what you do all the time. Again, thank you so much. And thank you at home for watching. We'll see you next time in State Matters.